I am proud. I am so proud that we have a governor who gets health. So please stand and welcome Governor Inslee.
Thank you. Thank you. Thank you. Thank you. Well, thank you for that really warm welcome. I appreciate it. I know that was really a welcome for Trudy, so thank you. We are delighted to be here. This is such an important topic to Trudy and myself, and I want to talk to you about why I consider this so important and what I think we can accomplish together. But first, I want to just on a personal note, what a moment of personal vindication this is for me to come talk to you about healthy children and physical fitness of our kids. And this is why it's a moment of vindication. As I was thinking about driving up here this morning, I was thinking about a day when I was growing up, when I was about 12 and we were in the backyard. I lived over on 116 Southwest in White Center area when we grew up. My dad was a biology and coach and PE teacher. And I remember one day we were in the backyard just playing football with my buddies, and my dad came out and said, "Hey, I want to know how fit you kids are." So he came out and he had all of us do pull-ups. And I've never been particularly lucky in the bicep department. So I could do about maybe 3 pull-ups, I think. And my dad just looked at me with that, dad look and said, "That is pathetic. You are never going to go anywhere, Jay, if you were so physically weak like that." And, all these other guys were doing 15, 20 pull-ups at age 12. I just can't believe that. And I stood up to my dad and I said, "Dad, I just want to tell you that you may think of me that way now, but the day will come when I'm standing in front of 300 physical educators and health-related people and give the keynote address on how to do physical education." So I'm going to tell him about that when I see him next. He's going strong at age 87 because he has been a guy that's been committed to staying healthy and doing work. And I grew up really lucky. My mom and dad gave me great opportunities to be outside. They worked out revegetating the alpine meadows on Mount Rainier with a group called Student Conservation Corps, which got kids from all over the country out hiking and doing work with shovels and chainsaws. My mom and dad made sure I was on a bicycle early when I was a kid, and now I'm still riding a bike and enjoying it, and gives me a chance to get a little oxygen to my brain on occasion to try to keep the governor's office operating. So I was really lucky. I got to learn to swim at Angle Lake right down the street here. And I've been fortunate from a health-related perspective because I had those opportunities, because I had parks to play in and parents to kick me outside and guys to grow up with. And I really was lucky. And now I am in a position to be able to help our kids reverse this horrific threat that now faces the next generation of epidemics and pandemics of diabetes and obesity that now threatens our next generation for the first time in American history to have a shorter lifespan than their parents' generation. I mean, think about that. Think about this technologically adept, a wonderful country we have, and yet have a situation where our children have a shorter lifespan than us. That is totally unacceptable to me as a grandparent and as governor of the state of Washington. And I want to talk to you about ways we can reverse that, and we can reverse that. This is within our power. We know what we have to do. Now, we're doing some of it right now. We've had some successes, and I want to talk about that just for a moment. I think it's a great thing that Washington State is leading America in the adoption of health care reform, where we have over 650,000 people with insurance in our health care reform efforts. And there's a lot of Our uninsured rate has gone down from 16 to 10%. We have 350,000 families insured today who did not have insurance last year because of our health reform efforts. And we know that's going to inure to the benefit to a lot of kids as their parents and grandparents become insured and are in a position to help their children experience healthy living. So we've had some really good things moving forward. But when you have a situation where your state's going backwards, when our state has always gone forward in so many ways, going backwards in the next generation health, is something that should be very, very alarming to us. And we know what the remedy to this is. This is within our power. We don't have to invent a new system of biology or a new unified theory of physics to solve this problem. This is within our control. It's all behavioral. It's all choices, and it's all what we do and how we decide to have fun and how we give our children opportunities to do that and a healthy nutritional background. So the bad news is our children are really threatened by this. The good news is it's under our control. This is something we can do as grandparents and educators and governors and health professionals. So I'm excited to talk to you about that. The gold standard research shows that we can bend the curve of childhood obesity if we act early in the course of children's lives by making health a focus of what we do as adults. It starts in infancy with supporting breastfeeding and establishing healthy eating habits early in life. As kids grow and develop, we need to make sure they got plenty of opportunities for education and plenty of reasons to turn off the television and step away from the electronic device. You know, we've had this old saying, step away from the car, right, by law enforcement. We got to step away from some of those electronic devices as adults. In school, kids need more recess time, not less. Our schools should be meeting. It is altogether fitting that we expect our schools to be meeting national physical education standards, have healthier food options, and support walking and biking to school. And focusing on efforts on these children, families, and communities who are most in need will give us the biggest bang for the buck. So my vision for the healthiest next generation is to support families in their choices to keep kids healthy in several ways. First, by supporting breastfeeding, starting in hospitals, and then supporting mothers in the workplace so that they can do this thing that pays off so much for long, long periods of time. Second, and dads are kind of left out of this a little bit, but we like to help every way we can. Second, by making water and healthy food available and affordable in our schools and in our communities. And that's something we can all be creative about. Trudy has a garden at the governor's residence that has been extremely effective in getting young people in to figure out how to garden and understand about healthy food. And we've taken about 500 pounds to the food bank last year. We can all do some creative things. I've seen creative things going on at Bainbridge High School that now is growing a bunch of their own food and has a zero waste policy in their cafeteria. It's working really, really well. Third, by making sure our kids are not only active in early learning environments in schools, but also in communities by having access to safe public places where they can be active and interact with nature. And we're going to make sure that we have strong performance metrics in our state agencies tied to our Results Washington program, which is setting up metrics of performance for our state agencies. And I got to tell you, I'm really inspired by what is going on in many communities across our state. We've collected over 200 examples of great work that are going on with local community leadership across the state, from K through 12 to communities to libraries in many, many places. And we've come up with recommendations that have been cross-referenced with evidence and the national recommendations from the Institute of Medicine CDC, and other organizations that really show what can actually work on the ground. So what we're doing is great, and you can be proud of your efforts in so many ways. But as you know, we need to do more because we're not cutting the mustard. This is a huge change in our culture. It's a change of systems. It's a change of attitudes. And we have to keep at it. This isn't going to be resolved just in our conference here this morning. And that's why the State Department of Health and Early Learning and the Office of the Superintendent of Public Instruction have all banded together with other public and private partners to tackle this important issue. And we know we've got Randy Dorn, who's always been one of the healthiest leaders in the state of Washington, starting with his days on the football field. We're bringing together great private and public partners who care about these issues, and it's important that obviously we listen to everybody up from the ground up to get their ideas to see what really works. Now, I've had a little taste of this young. When I was at Cascade Junior High School, just down the road, President Kennedy had started this effort. And we know that efforts like this are multi-generational. But what he started back in the 60s, we sort of fell off the bandwagon a little bit, and now it's time to get back on. So our first meeting of the council is this morning, and we're going to review the recommendations that we've received from multitude of sources to see what makes sense for our state in prioritizing what programs, what ideas, what initiatives are best for the state of Washington. And I want to thank everybody here for helping in that regard. So I want to just comment about the things that I've seen already that I hope we can build in our state with the Healthiest Next Generation initiative. Here's just a few of the things that have inspired me. In Skagit County's Mount Vernon School District, the bus fleet has dropped from 27 to 12 vehicles because of sequential start times, reducing traffic congestion and emissions from schools. Along with a new 1-mile walk zone around each school, this change allows children to walk safely to school and saves the district almost $250,000 and can demonstrate to kids how they can help reduce carbon emissions, which we know are so devastating to the health of our atmosphere. At the Parkside Grocery in the west central neighborhood of Spokane County, they are now selling locally grown produce and is the only WIC authorized corner store in the country. Isn't that kind of cool? We have the only authorized WIC store in the country in Spokane County. In Seattle Public Schools, PE programs are becoming nationally recognized. And innovative programs like the walking school bus are fun and healthy for kids. And I had a real joy walking to school one morning with the walking school bus, picking up kids at each corner, walking to school. Now, I think this is a big, big cultural change that we need to talk about with our parents. And here's why. Parents, and we can understand, parents concerned about the safety of their children. They're bombarded with horrific stories every night on the news about, some really terrible thing that has happened somewhere in our country to a child. And so it's understandable why parents have concern about the safety of our children. But we have to understand that for every one of those criminal acts, there's 10,000 acts of children becoming obese and are going to die due to early onset diabetes at age 30 if we don't give these kids a chance to walk a little bit. And we have to get parents to understand that there's going to be thousands of people and kids who die prematurely due to diabetes for every one of these difficulties that we have in these horrific cases. And I'm going to make sure as governor we give parents opportunities to get their kids out into parks and walking school buses and sidewalks and safe bike lanes so that they can live a long life and defeat diabetes in this state. And I hope that you're going to help me in that regard. So, We're partnering with the Robert Wood Johnson Foundation and YMCAs to make sure kids have access to water rather than sugared drinks in our schools. A partnership in Lincoln County Health District and the Davenport School District with the Lincoln County Hospital District called 54321, Let's Go Linco. That's a great logo. They do great work there. It supports activities that promote healthier eating, less of recreational screen time, and 1 or more hours of physical activity a day. So we're seeing this across the state. It's Snohomish County that has Fuel Up and Play 60. This is happening across the state organically, but we want our state to support these efforts in every way possible. Now, I'll mention one other thing where the state wants to be a great partner. I have an outdoor recreation task force, which is now coming back to us with recommendations for outdoor recreation. We know we've got a lot of work to do for the state to provide local communities the infrastructure to make this happen. One of those is to make sure that we have a healthy state park system, which has now had a cut in state revenues as a percent of their operating budget, more than 2/3, that is unacceptable. State parks is one place where parents can get their kids to really understand the joys of outdoor recreation. So the state's got a lot to do, and I'm going to be reminding legislators that when we think about our state parks, it's not just for fun, it's for health as well. And in our transportation budget, I can tell you that we've got a very progressive state DOT leader, Lynn Peterson, who is trying to reorient our State Department of Transportation to think about health as well as just commute times when we design our transportation systems. So we're going to do what we can to integrate state agencies around children's health, not just the health department. And I think if we're going to beat this monster of diabetes, we're going to have that universal approach across multiple systems and platforms, and we're doing it. So in closing, I just want to thank you for what you're doing. You're going to defeat diabetes, and we got to think of ourselves as warriors in that effort. But I also think we need to think of ourselves as funsters, meaning we are creating fun. And I think creating fun is a noble pursuit. And I'm serious about that. I took my 5-year-old grandson riding at Fort Ward on Bainbridge the other day, and I did something that I'm not sure should be highly recommended, but I just turned my cell phone around and took a little picture of him riding behind me, scooting where he reached, and he's very proud of this, and he made sure that everybody knows about this. He reached the incredible speed of 12 miles an hour on his bicycle at Fort Ward Park the other day. And I captured a really big grin on his face going 12 miles an hour. We're funsters as well as health providers. That's a noble pursuit. So let's get out there and make sure all kids have that opportunity. Thanks a lot. Look forward to working with you. Take care.